Hi there, Jeffrey Grossman here from Acupuncture MediaWorks and AcuPerfect websites, and welcome to Marketing Tip Tuesday. And today I want to talk with you about the steps of care and how to educate your patients through the various stages of care that they're going through in your care. We just printed up this new poster called The Steps Toward Health, and this poster is designed to help you move your patients through the educational experience and the awareness about how you could help them from relief care to corrective care to maintenance care and to wellness care. This poster helps you define all of that information and walk your patients through every single step of that. So let's go ahead and take a closer look at each of these elements of this poster. Right over here we have the relief care, and in relief care most patients begin care because they're in some sort of pain. And in this phase of care, it's important to let your patients know that when they come in, each visit builds upon the previous visit. And that's why visits are close in between there. So with this poster over here, each of these dots relate to acupuncture visits. And early in the relief care phase, when patients come in, each visit builds upon the previous visits. They're close together over here because you need to have a number of visits that are close in proximity to each other to elicit the greatest response to their health care and to their desired result that they're looking for. The next phase of care is called corrective care, and in this phase of care, signs and symptoms have been reduced, they're feeling better, they're feeling that they can accomplish more in their life, and when they get to this phase of care, the visits start spreading out longer and longer and longer over time. They may come in every other week, every 3 weeks, once a month, or however you determine that your corrective care phase works. And the next phase of care is called maintenance care. And in maintenance care, your patients have gone through a series of relief care visits, corrective care visits, and now they're at that place to help maintain all the progress that they've achieved so far. In this phase of care, it's more like tune-ups. They come in to help maintain everything that you've helped them achieve during their treatments and protocols that you've suggested and you've done with them over since the beginning they started care with you. In this phase of care, there's also a really important point that I want to stress to you. There's a point called the decision point. And in the decision point, your patients can choose one of two roads to go down. If they choose to discontinue care, and this is what you explain to your patients, and I'll go over that in a moment. If they choose to discontinue care, they might start going down this roller coaster of relapsing. And in this roller coaster of relapsing, they'll decide that they want to stop coming in to see you for regular visits, and then things may slowly get a little worse. They come in and then they see you for a few visits, and they get a little better, and then things get worse, and then they come in, see you for a few visits, get better, and then they get worse, and so on. That's the roller coaster of health. That's what you want to explain to your patients that you don't want them to go on. The other part of the decision point over here is your patients can choose to continue with maintenance care and moving up towards that progression of health, wellness, longevity, and achieving all the goals that they want to achieve with their health care. So with this phase of care, the idea is to move them up into this place up here where they feel great, where you see them once every quarter for an acupuncture tune-up or a visit just to check in with them to see where they're at. So I'm going to walk you through this poster in detail and how I would explain it to a patient. So I'm going to go over an overview as to walking a patient through the steps of care poster. So welcome, Marilyn. Hi. I want to show you the steps of care and the kind of phases and the stages of care that I'm going to walk you through as you come in care with me here. So initially, you're in this phase of relief care, which is you're in pain and you want to get out of pain fast. You came in to see me because you have headaches, you have migraines, and you have a difficult time sleeping. Is that right?
Yes.
Right. So in that phase of care, I put a person in relief care. So when you're in relief care, I want to help you as quickly as I can to overcome those conditions that are affecting your health and well-being and whatever it is that's affecting your life. So in relief care, what I do is I see people once a week for the first 8 weeks. And all these dots here are acupuncture visits. Each visit is really close in proximity to each other because each visit builds upon the previous visits. So what I do with you next week is built upon what I do with you today. What I do with you in 3 weeks is built upon what I do with you today and next week and so on. So does that make sense?
Yes.
Okay. So in this phase of care, in relief care, my goal is to get you out of pain as quickly as possible. And that's why treatments are close in between with each other. And my goal is ultimately to get you to this phase of care called maintenance care and wellness care. And I'm going to show you how we get there in a second. So once we get through the phase of relief care, we move to the phase of corrective care, which means that most of your symptoms and signs are gone, your headaches are minimal, you can function a lot more happily in the world, your sleep is improved, everything is getting corrected, you're getting better. And in this phase of care, visits start spread out over time. So I see you a lot less. So instead of seeing you once a week, I may see you once every other week or once a month or once every 3 weeks. Because my goal is I don't want to have you come and see me forever. I want to help you get well and healthy and to help you really accomplish the goals that you want, that you put down on your healthcare form with me. So in this phase of care, visits are going to be spread out over a different length of time. But there's a really important point that happens over here, this decision point right over here. So if you see this right here, this is a decision point. And at this point, you're going to feel better and you're going to start sleeping better, your headaches are going to be gone, and you're going to think to yourself, well, maybe I don't need acupuncture anymore. And you may not, but there's an important decision that needs to happen here. So you have one of two paths to choose. One, this is the path that you could choose, which I really don't want you to choose. This is called the roller coaster relapse path. And what happens here, if you choose to not come in for care, it's possible that we get you to this point where you're feeling good, everything's happy, and you stop coming in for care, things could get worse. And then you come in, I see you for 2-3 visits, and you go away again, and then things get worse. And you come in, and because we're not maintaining everything we've achieved so far. Does that make sense?
Yes.
So that's what some people choose, because whatever time restrictions or whatever it is that happens, but that's not the path I want you to choose. What I'd like to offer you at some point, and we don't have to decide now, we could choose later on as we move through care, is this path towards wellness and health. And the idea is that when you get to this point, this decision point, is to continue care, because I want to help you achieve your health goals. And the ultimate goal is to maybe get you to come in once a quarter, once every few months, a couple times a year for a tune-up. So I can make sure that everything that we've achieved so far in this phase of care and in this phase of care is locked in, and you're holding up, and that you are working towards those health goals that you really want. So ultimately, when we get to this point, you'll know, because you're like, gosh, I feel great. I feel really good. My headaches are gone. I'm sleeping better. And then you'll realize that, hey, you have a decision to make. The decision is either to go down the roller coaster of relapse, which I really don't want you to do, or to continue care, and we'll push visits out over longer periods of time, because each visit, again, really supports all those visits. And my ultimate goal, and I'll be honest with you, is I want to work with you for as long as you are willing to work with me, because I know that acupuncture has some powerful health and life-changing effects that it can offer people, and I would like to help you achieve your healthcare goals. And one way to do that is to kind of put you in this, to walk you through the relief care to get you out of pain, help, support you in the phases of care that we've achieved so far, and then to kind of help really keep you balanced, healthy, strong, and potentially catch any other problems that may be arising. So does that make sense to you?
Yeah.
Okay. So when we get to this decision point area, do you think you have an idea of where you might want to go?
Yes.
Where would you go?
I would go to the point towards health.
Okay. Awesome. Cool. Great. Well, thank you. And
thank you.
Yeah. Okay.
Thanks.
So that's basically it. It's a simple conversation that you have with your patients, walking them through the steps of care, steps of health poster really lays the foundation and the groundwork for long-term care. It plants that seed towards wellness. You bring a patient in, You let them, you explain to them what relief care is, you explain to them what corrective care is, what maintenance care is, and then ultimately you let them know that they have a choice to make at some point. They can either choose the roller coaster of relapse or the wellness and the health care that you can really offer them through acupuncture. So I hope you found this Marketing Tip Tuesday informative. If you want to find more information about this poster, you can click on the link below here. Otherwise, I'll talk with you soon. Thanks very much. Bye-bye.